name is Bukola Bolarinwa, and I am the founder of HIMA Health Initiative. HIMA was started about 4 years ago to help plug the blood supply gap in Nigeria. What we do is we help link blood donors to patients in hospitals in need of blood. We first started out by helping people who have sickle cell like myself, but then we expanded the service to help pregnant women, accident and emergency victims, people living with cancer and leukemia. And so far we've been able to successfully link over 2,000 blood donors to patients in need. We've also been able to collect almost 5,000 pints of blood by carrying out blood drives, different events across the country. However, when COVID-19 hit and with social distancing measures put in place, we're no longer able to have public blood drives at universities, churches and mosques, as well as social event centers, which are where we primarily get blood donors. And so now what we've had to do is pivot to create what we've called social distancing blood drives. Social distancing blood drives means that at the moment we can only collect blood at blood donation centers, which are usually in various hospitals across Nigeria. What HIMA is doing is that we're supporting donors by providing transportation. So we pick up our donors, take them to the blood donation center where we're observing strict social distancing measures and COVID-19 protocols, including extra hand washing, extra cleaning, and so on.
Bienvenue à Téléthéâtre ATB. Le téléthéâtre pour nous, c'est une occasion d'aller au-delà des publics qui ont l'habitude de nous voir, de donner l'occasion à ceux qui ne peuvent pas, qui n'ont pas le temps, d'assister à nos représentations, de se faire une idée de ce que nous faisons régulièrement sur les scènes, dans les villages, etc. Le téléthéâtre est donc devenu pour nous comme une nécessité aujourd'hui. Aujourd'hui où il est pratiquement difficile de se déplacer, de réunir du monde. Alors par la magie de l'Internet, nous pensons que nous pouvons faire en sorte que le théâtre continue à vivre, continue à offrir du plaisir, du bonheur, à susciter des réflexions. Les grandes pièces qui ont été des temps forts de la vie théâtrale de notre pays, vous allez avoir la chance peut-être de les revoir avec plaisir et pour ceux qui ne les ont pas encore vus, de les découvrir. Nous aurons également l'occasion de vous faire découvrir tout ce que nous faisons comme travail dans les villages avec les chantiers de théâtre communautaire. Vous allez voir à quel point il s'agit là de quelque chose de très très intéressant.
We use tourism as a tool to empower rural communities living in areas of high tourism potential but challenged by household poverty. Prior to COVID, we had engaged women groups to participate in homestead tourism, and the 64% of the 12,000 community members who we had mobilized and trained, they are now doing tourism as a business. With COVID, our programs came to a halt because the tourists were no longer coming, and we could not even continue with our outreach programs, which were focused in rural schools and households to improve hygiene and sanitation activities. So we are now looking for alternative sources of income for our community members. We are looking in two areas: rural health and income generation. We are seeking support to train 2,000 community members to become influencers to drive behavior change. We are looking at getting support to empower 200 women to start producing face masks and sanitizers and liquid soap to be able to continue getting income and also supporting their communities. We are also looking at empowering 30 households to be able to start backyard farming to mitigate food insecurity.